Chapter 13, Interpreting Physicians' Orders for Dosage and Day Supply. Day supply is the number of days a prescription will last. Important to input for insurance reimbursement. So when we mean day supply, we don't mean one day. We mean how long is this prescription going to last? So if they have 30 tablets, they take one a day. That's going to last for 30 days, and that would be the day's supply. So they had 14 tabs and they're taking one a day. That would be a 14-day supply. So we're not talking about how much they're going to need per day in this sense. We're talking about the whole prescription and how long it will last. An inhaler is a device used to deliver a medication by breathing it in through the mouth or nose, and a nebulizer is a device used to produce a fine spray of medication for inhalation. If you're already comfortable with the subject matter, you can perform the following calculations to test your knowledge. This is not graded unless it is in Canvas. So this would just be extra practice, which of course is always good. And we will go through some of the problems possibly on the pretest at the end of this. So I'm going to skip through those. The objective of this chapter is to bring together mathematical skills learned in previous chapters to accurately prepare medication for dispensing, given the information provided on a prescription. In some instances, the medical professional omits the number of doses of medication necessary or the dose to be given from a total dosage. In many instances, because only one element is missing, pharmacy staff can make the necessary calculation from the preparation without contacting the physician. As long as the physician provides a time frame for a prescription, the pharmacy staff is responsible for ensuring that the patient has sufficient medication to complete the desired medication cycle. Basically, the total dosage needed is the number of doses needed per day times the total number of days prescribed. So like I said, if they take one a day, we give them 30 tablets, 30 days. Same way with the number of days prescribed. This can be calculated with dimensional analysis, or in the case of solid medications, ratio and proportion. So at Ross, we do not teach the dimensional analysis way. We only go over ratio and proportions, which you can do either one, whatever you feel more comfortable with. But on the examples, I will do ratio and proportion. So we'll do example 13.1. Example 13.1, a physician orders amoxicillin 500 milligrams TID for 10 days. Available stock is 500 milligram capsules. The order reads as follows. Dispense amoxicillin 500 milligram capsules to be taken 3 times a day for 10 days. It's available in 500 milligram capsules. 3 capsules per day times 10 days equals 30 capsules. The pharmacy technician in a retail setting would prepare 30 capsules for the pharmacist to check for dispensing. In an inpatient setting, such as a nursing home, the date of the order and the ending date would be noted, so the medication would be discontinued 10 days later. With prescriptions such as this, most pharmacists will expect a quick mental calculation of the answer because it is simple multiplication. So just a little warning, that's a lot of what you're going to be doing. So eventually this will become something you just do in your head. All right, and we'll do example 13.2. The doctor prescribes Ceftonir 125 milligrams BID for 10 days for a staph infection. The stock strength available is 125 milligrams per 5 ml. How many ml are needed for the entire course of therapy? It says to use DA, which we know we won't do. So I'm going to go ahead and calculate how much we need for the entire course of therapy. So if we look at this strength of the medication, it's 125 milligrams per 5 ml. The doctor's actually ordered 125 milligrams. So we know that they're going to take 5 ml. And they're doing that BID, so that's twice a day. So that means that every day, 5 times 2 is 10. They're taking 10 ml per day. And then they're taking that 10 ml for 10 days. So our answer here is going to be 100 ml. And you could set this up as a proportion if you wanted. I just think it's a little easier just to kind of look at it from that perspective, because that's how you will be in the pharmacy setting. All right, we'll do example 13.3. A physician prescribes phenobarbital 1 grain by mouth every 6 hours for epilepsy. Provide a month's supply. So in stock, we have 30 milligram tablets. And then it says interpret the prescription. So they already did that. Phenobarbital 1 grain by mouth every 6 hours for epilepsy. How many tablets should be provided to fill this prescription? Well, if you remember back to the conversions, 1 grain is equal to 60 milligrams. So if we needed to give the patient 30 milligrams, hopefully you can look at that and say, okay, well, that's a half of a tablet that they're going to need. But if you can't, and don't feel bad if you can't, that's totally fine. We can do a proportion. So we can do 1 grain is equal to 60 milligrams. We need to give the patient 30 milligrams. How many grains is that? Oops, let me take that ass off. So that just looks confusing. And we would just do it normal. 60x is equal to 30 times 1, which we know is 30. We want to get x alone, so we need to divide both sides by 60. So now on this side, we have x by itself. And if we do 30 divided by 60 in our calculator, we get 0.5. So that right there just tells us that we need 0.5 tabs per dose. So they're taking the 0.5 tablets every 6 hours. So we need to find out how many times a day that is. So if we take 24 hours in the day and we divide it by 6 for every 6 hours, that is 4 times a day. So they're taking 0.5 tabs 4 times per day. Now in our calculator, we can just do 0.5 times 4. And that means that they are taking 2 tabs per day. And we need to give them a month's supply. So 2 tabs per day times 30 days. So 30 times 2 is 60. So we need to give them 60 tabs for the whole prescription. Then it says how many tablets are needed for a single dose. We already figured that out, that was 0.5 tablets. So a half of a tablet. And what is the dose in milligrams? And the half a tablet would be 30 milligrams. And then write the directions as they would appear on the patient's bottle. And that is going to be take 1/2 tablet by mouth every 6 hours. Example 13.4. On Friday, a doctor orders Tagamet 300 milligrams IM every 6 hours to be sent to the floor for the weekend. In stock, we have 300 milligram per 2 ml injection and 8 ml multi-dose vials. Interpret the order. So when we're interpreting the order, we're just going to say the medication name. So cimetidine, 300 milligrams intramuscularly. So basically, we're just kind of translating the SIGs and the abbreviations every 6 hours. And then how many vials of medication should be sent to the floor for Friday noon through the weekend with a sufficient amount to provide the medication on Monday at 6 a.m. So we just need to figure out how much they're using per day. So we need to provide them with 300 milligrams. The medication comes in 300 over 2 ml. So that means that every time we're giving the medication, which every 6 hours is 4 times a day. So every time we're giving it to them, we're giving them 2 ml. So 2 ml times 4 times a day means we're using 8 ml per day. And we want to have enough from Friday at noon through Monday at 6 a.m. So Saturday at noon, we'd only need still 1 vial. Sunday at noon, we would need 2 vials. So we are going to need to send, so Sunday at noon, we would need 2 vials. And then Monday at noon, we would need 3. But we're only going to 6 a.m. But we're going to have to send 3 vials anyway, because we are going to send the full vial. Okay, we'll do example 13.5 now. After adding 5.7 ml of sterile water for injection to a vial of powdered oxacillin 1 gram for injection, the resulting strength is 250 milligrams per 1.5 ml. How many vials are needed to prepare a 24-hour supply of an order for 750 milligrams IM every 6 hours? So we're going to do a proportion, of course. On one side, we're going to put the strength of the medication, 250 milligrams per 1.5 ml. We know we need to have the same units across, and we have an order for 750 milligrams. How many ml is that? So we're going to go 250x is equal to 750 times 1.5. So for this one, we're going to need to take care of that multiplication side first. So 750 times 1.5 is 1125. And then carry that down. All right, so now we want to get x alone. So we need to divide both sides by 250. That crosses out. We have just x here. And then on the other side, we're going to divide that by 250, 1125. And we get 4.5 ml. So just to get them to the 750 milligrams, we need to give them 4.5 ml, but they're also going to do that 4 times a day, every 6 hours. So that means that they need 18 ml for 24 hours. And now we have practice problems A. If you want more practice, you can go ahead and do these problems. It is not graded unless you see a practice problem A for chapter 13 in Canvas, which it shouldn't be. So we'll skip over those. Determining the number of doses in a container. If the size and frequency of the dose and the amount of medication in a container are known, the number of doses in the container can be calculated to ensure that the patient has a sufficient amount of medication for the expected time of administration. Basically, the number of doses in a container is the total amount of medication divided by the dose size. Excuse me. Okay, now we will do example 13.6. We have a prescription for furosemide 80 milligrams by mouth daily for 1 month. How many doses are provided in a 100 count stock bottle of 40 milligram tablets? So of course we can do a proportion going 40 milligrams is equal to 1 tab. We need to give the patient 80 we have an 80 milligram order. If we do our math, 40x is equal to 80 times 1, which is just 80. We want to get x alone, so we need to divide both sides by 40. So 80 divided by 40 is 2. So that means there's 2 tabs needed per dose. And then we want to find out how many doses are in a 100 count stock bottle. So we would do 100 over 2. So 100 divided by 2. The 2 is from how many tablets they need to get up to the 80 milligram dose. And that would be 50 doses. And write the directions as they should appear on the customer's bottle. Take 2 tablets by mouth daily. How many tablets are needed to fill this order? So they're doing it for 1 month. So if they take 2 tabs daily times 30 days, 2 times 30 is 60. Oops, what's happening? 60 tabs. Okay, now we'll do example 13.7. Example 13.7, a physician prescribed cephalexin suspension 125 milligrams every 6 hours for 10 days. In stock, we have 60 ml bottles of cephalexin for oral suspension, which is 125 milligrams per 5 ml after reconstitution. How many doses are in 1 bottle? So looking at what the physician ordered, it's 125 milligrams, which according to the strength, that's every 5 ml we give the patient is 125 milligrams. So that means that the dose is 5 ml every 6 hours. So we can just simply do 60 ml divided by 5 ml. We can find out how many doses are in the bottle. That's going to be 12. Will 1 bottle be sufficient for the prescription? So if they're taking 5 ml times 4 times a day every 6 hours, that means that they are taking 20 ml per day. And they're doing that for 10 days. So 20 times 10 is 200. So they need 200 ml for 10 days, which out of the 60 ml, no, that would not be sufficient. And how many bottles would we need? So 200 divided by 60 ml. Let's see what we get. So we need 200 ml and each bottle has 60 ml. So that means we would need 3.33 bottles. We can't give a patient a 0.33. So we would have to round that up to 4 bottles. We couldn't give them 3 because they wouldn't have enough for the whole 10 days. And we can't give them 0.33. All right, practice problems B. Again, if you want to work through these for more practice, I definitely recommend it, but it should not be graded unless it's in Canvas. Determining the length of a time a prescription will last. So it is important to know how to calculate the length of time a prescription will last if taken appropriately, which is also called the day supply. So that's what I was talking about in the beginning. The pharmacist uses this information to monitor patients' compliance with their medications. Additionally, insurance claims for refills will only be approved after a specific period of time following the last dispensing. If an attempt is made to refill too soon, the claim will be rejected. The pharmacist or pharmacy technician needs to know if the medication has been taken properly and when the medication can be refilled through the insurance. When entering new prescription information in the computer, care must be taken to input the correct day supply. This can affect whether the insurance company reimburses or rejects the claim. One of the reasons claims are frequently rejected is for incorrect day supply. This type of calculation can be solved with DA or ratio and proportion. So one thing I always tell students and people I've trained in the pharmacy, if the pharmacist has to update all of your day supply after you enter the prescription, they are not going to like working with you too much. And I don't mean that in a bad way. It's just they want someone that's going to be efficient and do things correctly. So if you enter in the wrong information on the prescription label or in the day supply field, you're basically making them do your job as well. So just kind of keep that in mind. Also, we didn't want to get insurance to come back and do a chargeback because we put in the wrong day supply. And then they do not pay the pharmacy for the prescription. So basically, we're out the cost of the medication. So one thing that's important when calculating day supply for insurance purposes, always round down to the closest whole number if you calculate a partial day. This will help avoid refill too soon responses. So if you're going to when you calculate the day supply, if it comes out to like 14.5, we wouldn't round up to 15 days because then they wouldn't have enough medication. We would have to round down to 14. Determining the day supply for tablets and capsules is the simplest of these calculations. Oral and IV liquids, insulin, eye and ear drops, and inhaler calculations require more steps. Labels for inhalers, which are used to deliver medication through the mouth or nose, will state how many inhalations are present in each container. Some medications intended for inhalation need to be placed in a nebulizer, which is a device used to produce a fine spray of medication. These calculations will depend on whether the medication is supplied in single or multi-dose containers. All right, so we'll go ahead and do example 15.8. A physician orders 60 tablets of antibiotic to be administered QID. What is the day supply? So if they have 60 tablets and they're taking it 4 times a day, 60 divided by 4. Which is 15 days. So a little note, use 20 drops is equal to 1 ml for calculating day supply of ophthalmic and otic medications for insurance purposes, unless your pharmacy specifies something different. So what that means is if your pharmacy, the pharmacy that I worked for in retail wanted us to calculate at 17 drops per ml. So there was a little bit of room for error if the patient misses their eye or if something happens. All right, so now we'll do example 13.9. Example 13.9, we have a prescription for Ocuflox ophthalmic solution, 5 ml. The SIG is 1 drop in each eye, QID for 5 days. So it says to use 1 drop or sorry, 20 drops per 1 ml for calculating day supply for ophthalmic and otic medications for insurance purposes, unless your pharmacy specifies something different. So what we first want to do, since we're dispensing a 5 ml bottle, we want to find out how many drops are in that. So we're going to use that conversion factor of 20 drops is equal to 1 ml. And then we'll plug in our 5 ml bottle. So we would do 1x is equal to 20 times 5. 20 times 5 is 100. So now I'll just write that as 1x is equal to 100. We want to get x alone. So we need to divide both sides by 1. And then we get 100 divided by 1 is just 100. So x was kind of already alone technically, but just to show you the steps so you don't get confused for later, it's 100 drops are in that bottle. Now we need to figure out how many drops they're using to find out the day supply. So they're doing 1 drop. So 1 drop, and they're doing that in each eye. So that means they're doing it in 2 eyes, right? So that's 2 drops. And then they're doing that 4 times a day. So 2 times 4 means that they're using 8 drops per day. And if we have 100 in the bottle and they're using 8 drops per day, so 100 divided by 8 is 12.5 days. Now, some pharmacies might want you to enter in 5 days because that's what the prescription said. Some might prefer you enter in how long the medication would technically last. That's just kind of up to the pharmacy. So another little tech note, pay close attention to whether directions are for one or both eyes or ears when interpreting prescriptions for ophthalmic and otic medications. So that will change your day supply based on if they're using it for one or both ears. All right, now we'll do example 13.10. A physician prescribes Dilantin suspension 100 milligrams TID. How many full days should this bottle of medication last? So we're going to do a proportion, of course, with 125 milligrams over 5 ml. And the doctor wants us to give them 100 milligrams. How many ml do we need to give? So 125x is equal to 100 times 5. 100 times 5 is 500. We want to get x alone, so we need to divide by 125 on each side. So 500 divided by 125. And that's going to be 4 ml. And they're doing that 4 ml 3 times a day. So 4 ml times 3 means that they're using 12 ml per day. So then we would just take the amount of medication or the amount that's in the bottle, so 237 ml, and we're going to divide that by 12 ml to find out how many full days we would have. So 237 divided by the 12 ml they're taking per day would be 19.75. So that would be 19 full days. And then it says indicate the prescription label directions. So we would say take 4 ml by mouth 3 times daily. Okay, now we'll do example 13.11. Example 13.11, a physician prescribes Humulin R 50 units subcutaneously at breakfast and 40 units subcutaneously before the evening meal. How many full days should this vial last? So if you remember, insulin's U100, which means that there is 100 units per 1 ml. And this is a 10 ml vial. So we want to find out how many units are in the bottle. So this is going to be 1x is equal to 100 times 10. So we'll take care of the 100 times 10 first, which is 1,000. And we don't have to get one alone because it's already alone. So the answer is just 1,000. Well, the answer is on 1,000, but there's 1,000 units in one vial of insulin. And that is something I would make a comfortable spot in your brain for because you're going to use that so much. So for a vial of insulin, not a pen, there's 1,000 units in one vial. Some of them, there are some higher strength ones, but for the most part, they're all going to be 1,000, especially in the retail world. So now we just need to add up how many units they're taking a day. So they're taking 50 and 40 a day. So 50 plus 40 is 90 units per day. And there's 1,000 units in the bottle. Oops. So we want to divide 1,000 divided by 90. Or sorry, divided by 9. Yes. So 11.11. So last 11.11 days, but we want to go full day, so it's just going to be 11 days. And how many vials of Humulin R should we dispense for a 1 month supply? So if they use one vial for 11.1 days, we can kind of figure that out, that it's obviously going to be 3 vials because 30 days in the month and this is lasting 11 days. But if you wanted to, if you needed to figure it out and it wasn't that simple, you would just add up the units, which we already did. So 90 units per day times 30 days. Now, if we multiply that together, 90 times 30, we're going to get 2,700. So they need 2,700 units for the whole month. So we couldn't just give them 2 vials, which would be 2,000 units, as every vial has 1,000. We would have to give them 3 vials. And we're always going to round the day supply of insulin down to the whole number of days and the needed amount of vials up to the whole next number, just like we just did. So just a little note, always round the day supply of insulin down to the whole number of days. So just like any other prescription, but the needed amount of vials up to the next whole number, because if we gave them if we rounded down, then they wouldn't have enough medication. All right, so let's do example 13.12. What is the day supply for the following prescription? Proventil albuterol inhaler, 2 puffs QID. In stock, we have the albuterol inhaler, 200 metered inhalations, 17 grams. A puff is the equivalent of an inhalation, and this inhaler contains 200 metered inhalations. So basically just kind of like how we've been doing, we need to figure out how many puffs they're using per day. So they're using 2 puffs 4 times a day, which means they're using 8 puffs per day. And we have 200 puffs. So now we're just going to go 200 puffs divided by 8 puffs per day. which means that that inhaler is going to last 25 days. Okay, let's do example 13.13. Example 13.13, what is the day supply for the following prescription? Acetaminophen with a codeine elixir, 5 to 10 ml every 4 to 6 hours, Pain, 120 ml. So when calculating day supply for insurance purposes, it is best to use it based on the maximum possible dose. So meaning here, this says take 5 to 10 ml. We're always going to assume that they're taking 10 ml. They might not, and that's fine, but we're going to assume that they're taking the full 10 ml because the prescription says they can. So we have to make sure that's available. Then it says every 4 to 6 hours. So we have to assume that they're going to take it the most, which would be every 4 hours. So if it's every 4 hours, we divide 24 divided by every Q4H. So 24 divided by 4 means they're taking it 6 times a day. So 10 ml times 6 times per day. That means that so 10 times 6 is 60. They need 60 ml per day. So 120 ml bottle, and they're using 60 ml per day. So 120 divided by 60. That means the day supply for this is only 2 days, which is pretty normal for a pain medication. Another note, never enter a day supply that extends past the beyond use date of the medication. For this reason, if the day supply for 1 vial of Lantus insulin was calculated to be 45 days, it would need to be reduced to 28 days. Dealing with day supply for topical medications is not an exact process. Generally, 1 gram of cream is considered to be an amount that would cover 4 flat hands of area. This requires knowing how much of an area is to be covered, which could be an uncomfortable question. Most pharmacies will have general guidelines to follow for day supplies of creams, ointments, and lotions. And again, we have practice problem C that you can do for your own practice. I know you should be pros. Just kidding. In some cases, pharmacy technicians may be asked to calculate the amount of medication to be dispensed when the number of doses per day and the number of days for treatment is known. On other occasions, the calculation of the number of doses of medication in a container may be necessary to ensure the patient has adequate medication to complete the prescription or physician's order. Finally, for determining day supply for insurance purposes, for monitoring refills to assess patient compliance, and for meeting insurance companies' regulations regarding restrictions on the amount of medication that can be dispensed at a given time. Pharmacy staff will be required to determine how long the medication should last if taken according to the directions. All of these skills may be needed to accurately dispense medications.